All right, welcome to everyone who is joining us for session A4. You are here to talk about, think about, and learn about intentional integration of intensive intervention. We went slightly crazy with I words in that title. My name is Brandy Simonson. I'm one of the co-directors of the Center on PBIS, and I'm joined by my friends and colleagues, Caitlin, Joey, and Joe. So if you say a Joe name, you're pretty close for half of us. We're going to be with you for about the next hour and 15 minutes to talk about intensive intervention. And for some of you, this might be the first session you're joining. So just a quick reminder about our conference expectations or our forum expectations. Of course, we're all about being respectful, responsible, and safe. And so we've given some guidance around what that looks like for the overall event when you're using chat and also when you're using polls. So just a couple of other reminders about the platform. If you are with us, you got here. So I feel like that's the biggest win of the entire piece. You will be able to engage with one of us who's not talking in chat and in Q&A. So one of the polls is actually the Q&A for this session. So please engage with us throughout and engage with each other as well. For chat, we're going to ask you to keep those to kind of small, brief questions. If you want to ask bigger questions that you'd like to hear any of us address at the end, please use the Q&A pod for that within polls. That'll allow us to track some of those bigger questions and talk. And Brian gave this reminder for folks who were on this morning or earlier in the day. But if you click around the Pathable platform, you can easily navigate away from our session. So just be mindful of where you click. If you're in Zoom, that's probably less of an issue for you. But Pathable is where you will engage in chat and Q&A. So please keep that open. And of course, if you actually need tech support, do not ask any of us. Go to the help desk in Pathable and they'll be able to set you straight. So with that, I wanted to do some quick introductions and we'll let each of us introduce ourselves. But Caitlin, Joey, and Joe and I will be spending time with you talking about our experiences and understanding of intensive interventions. And all of us have a relationship with some of the national centers who do this work. So obviously we're all here today because we're affiliated with the Center on PBIS, but we also work with the National Center on Intensive Intervention. And for sure, many of their resources and learnings have informed this work. And a newer center, the National Integrated MTSS Research Network, is also informing this work as we're talking about integration of interventions. So with that, I'm going to get us kind of going. We're going to start with a quick introduction. That'll be my part. I'm going to pass it over to Joe, who will talk about the background and rationale. And then we're basically just the warm-up act for Joey. She's going to walk through a case study of what intensive intervention looks like when it's truly integrated within a school. And Caitlin will do a wrap up and then we will join you all together for Q&A. So that is our plan. And our goal is that by the end of the session, you all will be able to think about kind of the when and why. So when is it appropriate to integrate intensive intervention? Why is there a benefit to doing that? We'll talk a little bit about the what. And then Joey's case study will really pull us into the how. What does it look like, sound like, feel like to really do this work with one student? So to set the stage, I wanted us to think about the way we have traditionally approached intensive intervention. So obviously, historically, as we've thought about integrating intervention, we've kind of talked about the silo of academic support, we've talked about the silo of behavior support, and within each of those silos, we've thought about a continuum. And when we've thought about what integration looks like, you've seen lots of graphics that kind of push us together, but we're going to think about why integration is critical. So one piece is students often join us and have both needs in social, emotional, and behavioral support and academic need areas. So we see students who present with needs in both areas. And for some students, those needs are directly related. So we see students whose behaviors are maintained by escaping academic tasks. And so if we think about addressing those needs separately, we're probably not meeting our students where they're at in terms of their integrated need. We also see a benefit in the opportunity to enhance practice for students. So if we really integrate social, emotional, and behavioral supports into our academic routines, we give students ample opportunities to practice the social, emotional, and behavioral skills, and vice versa. We set students up for academic success with good social, emotional, and behavioral support. For us as the adults in the building, we see efficiencies in what we're doing. So in this era, as we talked about this morning, where we can't keep doing all the things, Integration really allows us to be focused and intentional with doing a smaller number of things really well, which creates efficiencies for how we train, coach, and support adults. So coming back to what we integrate, and I got ahead of myself earlier thinking about this slide. So as we've talked about integration in the past, we've often thought about kind of pushing the silos together and creating an integrated continuum of support. And I think this graphic, which I give credit to George Sugai for this beautiful picture that shows that we're not specifically talking only in tiers, we really are thinking about a continuum. But as we're looking at this graphic, in some ways it feels a little bit simple in thinking about integrating it universal, integrating it targeted, and integrating it intensive. But the reality, as we've talked about over years, is each student may have needs that are met in tier 1, tier 2, or tier 3. So when we actually think about integration, it's a little bit more complex at the student level than just pushing the triangle together. So instead, we start thinking about how we create a continuum to think about at the kid level what they are experiencing. So to support all students, we're going to think about integrating tier 1. So in some ways, that's kind of our easy way to think about integration. We're going to push academic and behavior support together to create a unified approach in tier 1. But what about students who have more intensive needs, but only in one of those areas? Right? So we may have students who really only need tier 1 academic support, but would benefit from layering targeted behavior support or tier 2 behavior support on top of universal behavior, or students who have kind of universal academic needs or needs that are met in tier 1, but really have intensive behavioral needs. And so for them, an integrated approach looks a little bit different because we're not necessarily integrating intensive intervention. We're layering more intensive behavior support into tier 1 academics. For a different group of students, they may only need tier 1 behavior support to be successful, but they may need tier 2 or targeted academics or tier 3 individualized academics layered on top. For some students, they may need targeted or tier 2 support that's truly integrated. So they will benefit from tier 2 intervention in both academic and behavior, and integrating it benefits them the most. And for a smaller subset of students, we will truly think about integrating intensive tier 3 intervention. So kids who have significant, persistent, complex needs in both academic and behavior domains. And for that group of students, we're going to talk about the most individualized, the most intensive, and the most integrated approach to intensive intervention. So that is the section of the continuum that we are in today. And we wanted to walk through this picture because when we get to Joey's case study, you'll see that it is a very intense example. And so if you think about that applying in other parts of the continuum, it might not make sense to you. But if you think about it applying kind of at that most intense, most complex level of need, it's a great fit. So with that, I'm going to turn it over to Joe, who's going to walk us through the background and rationale.
Thanks, Brandy. I will have no fancy graphics, just to let you know that. So this is not news to anybody. Academic and behavioral problems are related, and this has been documented for a number of years. And if you look at longitudinal data on children who have problem behavior in schools, they're at a higher risk for failing a grade. They're at higher risk for not passing state competency exams. They have a much higher rate of dropout. And I would argue that children who show problem behavior with severe academic deficits are the children that we most struggle with in terms of teaching. And I'll talk a little bit about that reason for a while. So the question is why? And so we've spent, and a lot of people have spent time to try to understand why there's this common sort of coexistence of behavioral and academic deficits. And I'm not sure if we're ever going to fully answer that question, but it seems to be that one common thread is communication or language deficits that children with problem behavior often show. There's been literature to show that students, up to 80% of students with EBD have undiagnosed language deficits. And from a pragmatic standpoint, these deficits show up in a couple of different ways. Students don't know how to ask for help. their requests they make may be denied frequently. When they get academic content that's too difficult for them, they have trouble articulating why they're struggling or what the problem is as well too. So this notion of sort of not being able to communicate academic needs, not being able to communicate social needs, and being placed in these aversive interactions, we kind of see this pattern show up of kids acting out and teachers reinforcing that behavior. And many years ago, my old advisor sort of talked about the curriculum of non-instruction. And basically, there's this unwritten rule that happens when children act out frequently in the context of academic instruction. And what tends to happen is there's this sort of agreement of, okay, I leave you alone, you leave me alone, right? So there's been lots of descriptive studies showing that students with problem behavior receive fewer opportunities to respond academically. They receive far less positive reinforcement from teachers as well too. So this notion of like, and there's evidence to show that children who engage in problem behavior actually get easier academic demands from teachers because they want to kind of avoid that difficult sort of negative interaction that might occur. So while we're thinking about sort of this integrated approach, the link I think is sort of communication and teaching students the right way to ask for help, to allow them to tolerate denials of requests that might be made, to help them articulate where they might be struggling academically as well too. And Joey's case study is going to really show a really intense case where a child shows all these sort of deficits and how her and her team sort of approached taking care of these deficits. So we all live in a world of sort of systems, right? And systems are very good and are very important for providing high quality instruction and behavioral support to kids. So we have to think about intensive intervention, but the problem is that historically, I think these systems have not really communicated very well together. Going to the next slide. So my experience, and I think a lot of people's experience has been that we tend to think either about academic behavior interventions or behavior interventions, and we don't really often communicate about those things together. And so while you might have great systems for academic support and great systems for behavioral support, if those systems don't communicate well, then I would argue that we're not being efficient, we're not using resources in the best way possible, and as Brandy brought up earlier, we're missing opportunities for providing both support academically and behaviorally at the same time. And I think that's where we think about this integrated approach for some children who might need both help in both areas as well too. That issue is also coupled with the problem that from a teacher training standpoint, we don't do a very good job of cross-training individuals. Certainly the literature is full of examples of where most teachers don't get very well trained in behavioral support, and that spills over to what happens in schools as well too. But if you think about the way schools work, you have a behavior support coach, you might have an instructional coach, and the question is how often do those people actually work together and bring those things together? So the lack of preparation, this sort of independent thinking about behavior support and academic support as two separate entities, I think does create some problems when we're trying to address children who have these dual deficits. So as I mentioned earlier, this sort of notion of sort of systems for behavior, systems for academic, they can look great independently, but this siloed approach, I think, really has some barriers to really maximizing our attempts in terms of improving school outcomes for kids. It's an inefficient source of resources. It's, we've tried this where we've asked academic coaches to provide behavioral support and they either don't know how to do it or they don't have time to do it as well too. There's an issue about what takes precedence. I've been to some schools where the behavior support team really runs the show, right? And that's great for these children, but if we don't address their academic needs as well too, those poor outcomes that I mentioned at the onset are going to continue, because if you can't read when you're in the 8th grade, you don't have a lot of options in terms of what your next 4 years of school might look like as well too. But I think the biggest takeaway or the biggest barrier is that we're missing opportunities. And you'll see in Joey's example, well integrated behavior and academic support really does create an opportunity to provide practice and provide support in both areas at the same time. And when you think about the academic deficits these children need, teaching those communication skills that can help them navigate some of the triggers that may elicit problem behavior, by teaching them how to sort of tolerate the academic demands that are placed on them, that to me is really a way for us to say, we can teach you and support you in terms of how to be more pro-social, but also teach you and thinking about being dealing with academic deficits as well too. So this notion of an integrated intervention, we think, is a solution for these types of kids who really have those intense needs in both particular areas as well. And this idea of integration is talked about a lot, but I think the field up until recently has really struggled with how best to provide those integrated supports. As Brandy mentioned, the MTSS projects that are going on now are really attempting to do this, and they're really trying to push the envelope in terms of how to think about integration as well too. But there's also some really great work being done in clinics and in some schools where resources have been unified to where we can address these things together. But we really need to think systematically and from a system standpoint about how we best can do this. So this is not unfamiliar to the audience here, but really this notion about integrating systems and data and practices all together. And I like this graphic because it really highlights the need that it's not saying behavioral systems or academic data, it talks about those things together. So really using data, using these systems in the most efficient way, I think, and I think our team thinks, is really one approach to sort of start pushing the field a little bit further in saying, let's really think about how these things work together. Where are the opportunities for us to sort of provide support both academically and socially that we can actually really strongly improve the outcomes for children with these intense needs. So we like to think about intensive intervention practices in sort of these three chunks right now. You have prevention strategies that fall under this antecedent umbrella. So we think about contextually ways we can organize environments, organize instruction that can really sort of prevent problem behavior from occurring in the front end. But that's only going to take us so far. We also had to think about instructional strategies, both academic and social, that really allow us to teach replacement behaviors. So instead of a child throwing a piece of paper because they don't want to do the academic task, or walking out of the classroom, or putting their head down, thinking about those replacement behaviors that really are more appropriate, that can really communicate that need, that I need help, right? And shape those more desirable social behaviors in the context of academic instruction that will really allow them to sort of benefit from both of those systems in place at the same time. And then finally, in this last point, really thinking about the importance of high quality, contingent, positive consequences that are designed to reinforce those newly formed replacement behaviors that are appropriate, but also to minimize and decrease those inappropriate behaviors that might have been the ways that child had been communicating in the past. So a little bit more deeper dive in antecedent strategies, redesigning environments, promote reading and behavioral skills. Joe's going to show you an example of that. Creating predictable routines that the child knows what's coming and knows what the consequences are going to be. Really looking at the context of materials that are being used. And this, I think, is a very important point because I think we oftentimes don't really take that into account, but really making sure the materials are where the child is academically and socially, and then providing those pre-corrections, those prompts for that child to sort of what we're expecting them to do and what they're going to get if they do it as well too. Then moving on to the instructional strategies. For children who have intense academic and social needs, explicit teaching is necessary, right? Teaching desired academic skills in a very predictable, explicit, repeated sort of way, using those same strategies to teach alternative behaviors, and think about once those goals are met, teaching ways to those skills can be generalized and become fluent and move on to other settings as well too. And lastly, again, this is, I'm sure, a theme that you've heard consistently, the importance of positive, specific feedback, making sure that we're bringing more positive than negative to children, making sure that we're reinforcing those behaviors that based on the function of the child's problem behavior. So really focusing in on, are they trying to escape academic tasks? Are they trying to get attention from the teacher? And using those reinforcement strategies to support those more appropriate forms of behavior. And then again, sort of when I think about integration, sort of putting these things together, but also recognizing the need that we might need to layer on other support. So if you pull an intervention out of the box, it might work, but it's likely for the types of children that we're talking about, those kind of upper intensive academic and behavior needy children, really think about the addition of what kind of strategies might be added on or laid on top of those interventions to make them even more powerful. So I'm going to take it from here and give it to Joey, who's going to go through a very, very important case study that demonstrates these sort of approaches.
Thanks, Joe. And thank you, Joe and Brandy, for really setting the stage for this case example by talking about when and why we need to integrate supports for children with comorbid academic and behavioral skill deficits. And then also, Joe, thanks for starting to clue everybody in as to how we do those things. And it does look a lot like the siloed approaches we take for each set of deficits. But now we'll look a little more closely at one example of those two things really being combined, and looking at the way that skill deficits in both academic and behavioral domains interact for this particular student. So just as to contextualize this case example a little bit for everybody, I run a practicum experience for master's students in special education who are learning how to apply the data-based individualization process to support learners with severe and persistent behavioral difficulties. And as I'm sure this comes as no surprise to you all, but those students with their severe and persistent behavioral difficulties also have some pretty long-standing academic difficulties. We know those comorbidities are really common. So I have several case examples like this, and I chose one that really illustrates the iterative nature of providing integrated intensive academic and behavioral supports. So that said, as I talk through this case example, we'll talk through it in terms of 3 different iterations on this intervention package. And they almost look like different intervention packages. And you'll see that sometimes we're really integrating academic and behavioral supports, and sometimes we have to kind of take them apart for a while so that we can integrate them once again. And this is a real life case study, so it's very messy. And I hope that instead of the messiness putting you off, you can kind of see yourself as a practitioner in these procedures and these data, because it is hard to collect really good, stable measures over time for kids who miss a lot of school or miss a lot of intervention sessions because of their problem behavior. Okay, so without further introduction, let me tell you a little bit about this student. We'll call him Joshua. At the time we initiated supports for Joshua, he was in 3rd grade, 9 years old, had a primary label of emotional disturbance, and he attended a special day school for students with emotional and behavioral disorders, essentially students whose behavior was too severe and persistent for them to be adequately supported in their neighborhood schools. So they were remanded to this setting with the intention of graduating back to their neighborhood schools. Joshua was referred to us for his behavioral problems, but also for his deficits in reading, specifically in phonics, and of course, fluency as an extension of that. And it's just important to note that his problem behavior was intractable, particularly during reading instruction. This is the kind of student for whom you start to pull out the instructional materials. He sees the teacher manual from the reading curriculum and starts to throw his materials, right? So he's trying to avoid instruction before it even begins, which, as you can imagine, made it really hard to accurately assess his skills. So little had been understood about his cognitive or language abilities. Notes in his record from a school psychologist indicated really he'd never been cooperative enough during assessment sessions for them to generate valid scores about his cognitive ability. We did attempt some reading assessments of our own in conjunction with looking at what the school had. And I'll just say that on the Woodcock-Johnson assessment, the reading subtest, letter word ID, word attack, oral reading fluency, We saw very low grade equivalences, less than first grade level. Again, his problem behavior during assessment might have had a lot to do with that, but it was also clear he had some real skill deficits. Also very low percentile on the district MAP reading assessment. That gave us a little bit to go on, but not a whole lot. The school also had some curriculum-based measures, and we collected some as well. So this list includes those collective measures. And he had strengths in phoneme segmentation fluency, so he mastered out of that and was willing to cooperate with it. And also, according to school data, had mastered out on letter sound fluency probes. His relative weaknesses included word identification fluency, so high frequency words that were relatively simple and decodable. Had a tough time with that, and also, as a natural extension of that, struggled with passage fluency. So, understanding those strengths and weaknesses, we selected a starting curriculum, a direct instruction curriculum, which was Horizons Fast Track AB. There is some support out there for use of this curriculum, and specifically curricula like it, scripted DI curricula for children with EBD. And we chose that in part because we had access to the materials, and that's important in real life, right? It's hard to acquire new curricula if the district doesn't already have it, or if you can't access it in some other way, but also because he'd mastered letter sound. So if he hadn't, we would have started with reading mastery, a related curriculum, but because he had, we started with curriculum. He was placed at lesson 1 in the curriculum placement test. We also supplemented the curriculum with some phonics exercises that really matched well to the words and letters being presented in the lessons. We did this in a one-on-one format for 25 minutes, 3 days a week. So not a terribly high dosage in terms of the number of minutes he spent, engaged with the curriculum each week, but it was one-on-one. So all of the opportunities to respond were his. And now I'll just note, remember I mentioned that this is something that we delivered through a practicum experience for students in special education and applied behavior analysis. And that means that we had more resources at our disposal than you might. So I think this calls back to what Joe brought up about systems level examination, how we need to really think about how we can get intensive interventions in place for learners. But we'll have to suspend reality for a little bit and just think about what one-on-one instruction looked like for this child. But okay, all that said, we've sort of started to design a reading program for Joshua. But remember, he also has severe behavioral deficits as well. So before we rolled out our reading instructional program, we looked at the FBA data that the school had. They'd identified some target behaviors. They said, really, this behavior is episodic. It might start with verbal refusal or maybe passive noncompliance, but it's a little more on the active side. But it's going to escalate quickly to verbal aggression, property disruption, such as pushing, knocking over furniture, chairs, desks, to throwing his body on the floor, leaving the designated area, even the classroom or the building, all the way to physical aggression when he was striking or hitting, including attempts at other individuals. So this is problematic. And that escalation kind of occurred as problem behavior went unreinforced, if you can picture that. So some antecedents they identified as being relevant included these: when preferred items and activities were restricted, when reading and literacy instruction was presented, and when teacher attention was diverted or the quality of it changed. And I'm just going to note that in school, often when instruction is presented, preferred items and activities are necessarily restricted at the same time. And if we're moving from a free choice or, high preferred activity to a low preferred activity, there's often a corresponding change in the quality of teacher attention. So it kind of created this super powerful antecedent for problem behavior because these things tended to hang together. But what's important for us to think about as we look at the antecedents identified for problem behavior through Joshua's FBA is what consequences they each indicate. So these indicate different maintaining consequences. And it kind of cuts across the board, right? If we think of those categorical functions, we're looking to develop hypotheses about in an FBA. So the restriction of preferred items and activities leading to problem behavior suggests that access to those things can reinforce problem behavior. Problem behavior in the presence of instruction suggests that there's a value in escaping from instruction. And finally, a reduction in the quality of attention as a common antecedent to problem behavior suggests that high quality attention may reinforce problem behavior. So there's a lot to work with here. And I think this just points to the complexity of the problem behavior of the student, but I don't think he's unique. I think you might be able to picture students who also like to kind of have things their way, regardless of whether it's about instruction or having their request for their stuff denied. So to summarize, there's kind of this conjunction of antecedents to problem behavior. Problem behavior escalates in a sequence, not always in order, but definitely from low intensity to high intensity. And the reinforcers that the team hypothesized would kind of control problem behavior or sort of kept it going, even if they weren't always delivered at once, included having those things back, attention and tangibles, and getting out of the task or delaying it. So yes, that's just a summary of the many variables that influence problem behavior for this child. So we asked ourselves, okay, let's think about those ABCs in terms of intervention that Joe presented shortly before handing over the screen to me. Specifically, we thought about, okay, how do we prevent problem behavior during reading instruction, which is really the targeted area for us? Well, we're going to level instruction appropriately, and we've worked hard to do that. And so that's kind of the first place where we start to integrate academic and behavioral intervention. We're making sure we're not delivering instruction at a frustration level, but also that it's not too easy, because that might matter as well. So we're trying to kind of hit him where he needs it, but not challenge him too much. Second, we need to teach some replacement behaviors that we can shape into desired behaviors, as Brandy and Joe put it. So we want him to, this student Joshua, request breaks appropriately. So there's that communication skill that we want to replace problem behavior. Joe reminded us that EBD often comes with deficits in communication and language. Also, we want him to cooperate with instruction. So yeah, we want him to learn how to ask for a break, but we also want him to do the work. So that's going to pay off as well. So to really increase the likelihood those things happen, we have to think about how we respond to them, those skills when they're used. So we said, all right, if he asks for a break, first we're going to teach him how, but then we're going to immediately provide a break if he requests it. If he cooperates with tasks, then we'll provide a break contingent on some amount of cooperation as well. And maybe that's going to be an enriched break. And here's where we can hit some more categorical reinforcers or functions. So the break request gets him break. That's that escape function right there. Cooperating with the work gets him break plus tangible. So those are two functions there. And maybe we can even throw in some high quality attention during that break. Then when problem behavior does occur, let's briefly prompt him to use one of those alternative skills. Okay, so we taught the break request. We said you can request it verbally, say break please, I want a break. You can just say break. We also provided a card and said you can just touch this card and exchange it. And we explained that verbally, but we didn't assume that was sufficient because children often have undetected language deficit. So we also role played. We modeled it for him. We had him engage with it and contact the break itself. And when he requested the break during those role plays, they produced a 1-minute timed break. Again, it was unenriched. It didn't have any stuff available in it, but it was a break. It could terminate instruction immediately. And while we set the timer for 1 minute, he had the option to request a break again once that time elapsed. So that break could continue as long as Joshua needed it. In addition, we programmed some supports to increase the likelihood he would cooperate with reading instruction. So we used a token system. He earned tokens, parts of a clock, for meeting each school-wide expectation each time the teacher was cued. And that teacher was cued by a vibrating timer device about every 2 minutes on average. So the timer would vibrate and the teacher would make the judgment, he is meeting each school-wide expectation. For them, they had an acronym SOAR, safe, on task, act responsible, and respect all. And those had been taught explicitly through the school-wide PBIS system. But if he was meeting all those expectations, he'd earn a quarter of a clock and could accrue quarters of a clock toward minutes of free play time. Each full clock was 1 minute of play. And clocks could also be exchanged for consumable tangibles, snacks, things he could take with him. But he tended to always choose time to play. And I'll just note that this is a dense schedule in some respects. in that every 2 minutes he could earn a token. And in a class-wide scenario, that might be pretty hard for a teacher to implement, but in a one-on-one intervention, it's not as dense a schedule as it could be, especially considering each token only translated into 15 seconds of play. Just want to point that out because I may come back to that idea in a little while. There might be some room for intensification here. But this is what we rolled out. This is our starting intervention package. Remember, we selected an academic curriculum carefully, supplemented it with some additional instruction, created opportunities for Joshua to communicate his need for a break, and also a reason for him to kind of stick it out and cooperate with the work. So initially, you know, we start looking at his academic outcomes across sessions, and things are headed in the right direction. We're pretty happy as a start these first few weeks of intervention. But I will note that in about week 3, we started to see more problem behavior during instruction. And by weeks 5 and 6, we could no longer get him to cooperate with our word identification fluency probe. So I'm sorry, I didn't orient you to the graph, but our y-axis here is words correct per minute, and our x-axis displays weeks. So you can see that we saw an increase in his performance on those WIF probes until he would no longer respond to them. So unfortunately, we don't know how his reading skills continued to develop past week 4, but it wasn't likely they were developing because we were seeing so much problem behavior during instruction. And at this point, and you might be thinking, gosh, why didn't you already have a progress monitoring system? And we didn't. We were kind of just trying it out, seeing what happened. Shame on us, but we developed a crude rating scale at this point. We said, okay, for this next week, we're going to start to measure his performance behaviorally. And again, this is a very crude scale. A 0 was that Joshua didn't complete the session at all. A 1 indicated he completed the session, but demonstrated some severe problem behavior. And by the way, a 0 did not complete session. That was when he was actually removed from the session due to the severity of his problem behavior. That wasn't just a passive or a reasonable choice. It was because he was, engaging in property disruption, leaving the area, et cetera. So 1 is, again, he made it through our 25-minute session, but we saw severe problem behavior. A 2 is he completed the session with no severe problem behavior. Now, there may have been some off-task behavior and some minor disruption, but no severe problem behavior. So you can see in this graph, our behavior ratings are decreasing across the 5 sessions in which we made this rating immediately following. So it's a little bit of an approximation to DBR, but not as sensitive. Ask yourself, looking at this graph, is that a satisfactory response to our initial plan? Keep in mind that the reading data had been headed in the right direction, but then we didn't have any more. So I would say no. We had a plan based on our assessment data, and we implemented it. We looked for a response, but we were not satisfied, obviously. So we proceed to this second iteration, right? So when we have non-response in the DBI process, or whatever process it is that you use to think about when and how to make changes, we said, all right, non-response means let's do a little more assessment so that we can have an informed adjustment to the plan. And maybe those adjustments have to do with increasing the dosage of something, increasing the alignment of the supports with skill deficits of the student. But whatever that is, let's develop some questions that can help us adjust the plan. Develop an assessment to help us answer those questions, adjust the plan, and look for response. All right, so we proceeded to some further diagnostic assessments. The questions we wanted to answer that we thought could help us really dial in his instructional program included the following. First, we saw that in the Horizons curriculum, there are lots of different types of OTRs, and we weren't really able to tell, just based on our anecdotal observations, whether there was a pattern among which of those types of opportunities to respond problem behavior was most likely to follow. So we looked and we said, okay, there's letter sound ID here. There are decoding tasks, meaning in Horizons, the word is presented. You can see the letters and you read the word one sound at a time without blending. And also word reading tasks in which it's just, here's the word, read it without any of those scaffolded supports. We also noticed that his problem behavior had onset around week 4 or 5. And that's when the OTRs had started to change in Horizons. So we were really interested in these less supported word reading demands. So we thought, okay, well, if we can learn at least what he prefers to do among those different types of tasks, that could help us supplement instruction further. Second, we were thinking about the reinforcers we were offering for cooperation. And we thought, is there some way that we could increase the quality of reinforcement that's available when he exchanged his clocks? We noticed that he liked playing on the iPad, but liked to interact with other people while he did it. So we said, well, let's just see if he'll choose to play by himself with someone narrating or play in parallel with somebody else who's also on an iPad. Finally, part of why we wanted to answer those first two questions is to answer the question, can we use that information? If we have a higher quality reinforcer, can we make it contingent on a less preferred task and increase his cooperation that way? So these might be different questions than you're used to asking yourself. So I hope this could be exposing you to something new. But now I'll tell you how we answered these questions. And we used what I'll call a choice assessment. In the intervention literature, you might see concurrent operant assessment or concurrent operant analysis. But really what we're doing is just looking at, given two choices, where will the student spend their time? So we divided a table in half and we placed different tasks on each side. So for example, we might have letter word ID on one side of the table, and decoding or word reading on the other side. During each choice pairing, Joshua could earn clocks just as he normally could during instruction. So we didn't want to assess without some behavior management procedures in place because his behavior was so sensitive to the presentation of demands. And what we did is just measured the time he spent in either condition. So we cut him loose, said, okay, here's what's on this side of the table, demonstrate it. Here's what's on the other side. Do the thing you feel like doing. And the teacher would just move from side to side according to Joshua's choice. We did that for 5 minutes and simply recorded how much time he spent on each side of the table. I'll show you what we learned. Also one other note. So I said we had behavior management procedures in place here. The difference was, since these were only 5-minute sessions for us to evaluate his choices, we made the schedule of clock earning denser. So he had the opportunity to earn a quarter clock about every 30 seconds instead of about every 2 minutes. And we saw very little problem behavior during this assessment, even though we were presenting the same academic demands we presented normally. So that kind of said, maybe we should, enrich the schedule of reinforcement for him during instruction. All right, so here's the results of these choice pairings. So first we had reading CVC words on one side of the table, decoding on the other. Remember, reading, I just mean he was presented with the word, had to produce the word. Decoding, reading the sounds in the word. He spent almost all the time in that 5-minute session on the decoding side. So we said, okay, well, he prefers decoding right now today. So then we said, all right, how about letter sound ID versus reading words? He preferred letter sound identification. So that's good to know. Now we know reading CVC words lost both times. That's the least preferred OTR. Then we aren't finished yet on this preference or finding this hierarchy of preferences among instructional tasks. We looked at decoding words versus letter sound ID. And I don't know what your prediction is, but I thought he'd go for letter sound ID because to me, it seems like the lower effort task. But in fact, he preferred decoding, which to me suggests the work needs to be not too hard, but also not too easy. Remember, the school's data suggested letter sound ID had been mastered. So here we are, he prefers decoding. It's kind of somewhere in between those other two tasks. All right, so we've ranked our tasks according to preference. Next, we looked at his play preferences. We said, if you sit on this side of the table, you can play on the iPad by yourself. If you sit over here, but we'll be here to talk with you. If you sit on this other side, I'm going to grab an iPad too, and we can play the same game and interact about it. And he preferred that parallel play to quite an extent. He spent 100% of his time on that side of the table instead of just most of the time. Finally, what was left was to kind of mix it up on him. We said, okay, you can decode CVC words on this side of the table and earn clocks to play by yourself, less preferred play context. Or you can come to this other side and read CVC words and earn clocks to play with me on an iPad also. And here Joshua stamped his foot and said, y'all are going to make me play alone. And I share that little anecdote just because I thought it was so interesting and so telling. He considered that choice, even though we were offering a free choice, to be somewhat coercive because of the way we were leveraging his most preferred play activity versus his least preferred task. And it sure sounded from his verbal behavior like the task counted more than the play. And indeed, he spent his time on the decoding side, earning clocks to play on the iPad without someone else playing in parallel, even though we hung out with him. So his demand preference did outweigh his play preference, which to me said, okay, reading CVC words is legitimately really hard for him. Maybe that's no surprise considering academic data I've shared, but I think we've kind of ruled out motivation as much of an issue here, right? Because we offered a highly preferred play context contingent on reading words. Now, if we had more time, we might have tried to play with this a little more. Well, what if we offer you more parallel play time for reading CBC words compared to the amount of time you can earn for decoding? But we said, okay, we've gotten some really good information here, and we moved on. I'll also note that during letter sound ID, when he spent time on that side of the table during the earlier part of the assessment, he made errors, which was really important for us to know as well, because it did not actually look like he'd mastered that skill. So we used the information we got from that assessment to make some antecedent adjustments. Remember, prevent is kind of the first place we want to start. So we'd already leveled the instruction with the curriculum and supplemented it according to what we knew about his deficits, but now we have a little more information. One, we need to do fluency practice with unmastered letter sounds. And the great thing is that was a moderately preferred task relative to decoding and word reading. So he doesn't hate it as much as word reading, so to speak. So we could probably get that done with that denser schedule of reinforcement, but I'll come back to that. We also provided some scaffolded fluency practice for CBC words. So the Horizons curriculum did this to some extent, where it would have us present a word, and first we would have identified the sounds that are necessary to read that particular word. Then the student says the sounds in sequence or decodes. Finally, we ask the student to blend after they've identified the sounds. And of course, we'll provide prompts and models as is best practice. But what we did is we pulled the words from the Horizons curriculum and did supplementary practice on those words before proceeding through the Horizons lesson. So that's how we adjusted academic instruction based on this sort of academic and behavioral choice assessment. We also revised the consequences. We decided to strategically offer that more preferred reinforcer, parallel play on the iPads. And we said, let's do that when we're going to present word reading demands particularly, but maybe also decoding demands. And that really looked like, Joshua being able to earn clocks toward playing in the regular way on an iPad with an adult nearby versus clocks on a different token board to be accrued toward parallel play. We did that when we introduced new content in a Horizons lesson, and also when we really needed him to cooperate, like for those CDM probes. We said we really need to be able to understand his academic progress, so let's apply that strategically. We didn't just use parallel play all the time because we didn't want it to lose its potency. We didn't want him satiated on it, so we were strategic about it. We also enriched the schedule of reinforcement. I mentioned earlier, we started out with token earn opportunities coming about every 2 minutes on average. We decreased that interval to about 30 seconds. And here's what we got. So this phase change line is when we did the assessment. Those next 4 data points demonstrate days when we implemented the revised intervention, and we saw improvement here. Now, I wish I had more data, but it was the very end of the school year, and I think everybody appreciates how hard it is to get stuff done then. It was really hard to get them in sessions. School was doing fun stuff. So, but it was promising, and we had a good place to start for the following school year. So the next school year, we continued work with Joshua, and we started out with that intensive reading and behavioral intervention model we had kind of refined the previous school year. We did start using a DBR system this time, and we were rating his behavior on meeting school-wide expectations, or SOAR. So it was our own individualized version of direct behavior rating. But that just meant at the end of each session, the interventionist, the master student implementing the program, rated what percentage of the time they thought Joshua had spent adhering to those school-wide expectations, which were also class-wide expectations. Unfortunately, we saw plummeting ratings over the first couple weeks of intervention. In addition, in a 4-week, about a month-long period overlapping with collection of these data, Joshua had office discipline referrals 4 times for verbal threats, twice for property destruction, and twice for bullying. And he was spending a really concerning amount of time out of class due to problem behavior daily. I'll also note, and I should have mentioned this earlier, in the spring and also in this beginning of the next school year in the fall, Joshua never used that break card. And it was not because he didn't understand how. It wasn't because the effort was too high. Remember, he could just touch the card, even though he was able to communicate verbally, didn't use the breaks, okay? So that's just important to think about. Also, his problem behavior had kind of developed further to include more physical aggression than it previously had. So behavioral concerns. At the same time, we saw his cooperation with progress monitoring probes rapidly decline, along with his performance. So here are his words correct per minute on passage fluency, which was our primary measure in the fall. We were still collecting word identification fluency as well. So this really looks like an effort problem, but there were some skill issues as well. He was definitely still acquiring reading skills. So here's where we ask ourselves, are we satisfied with Joshua's response to the adjusted plan? And no, right? Severe decreasing trends in both behavioral and academic domains. So it's time for more diagnostic assessment and another adjustment to the plan. And here things had become so intractable, we really went back to the drawing board. So I'm going to remind you of some of what Joe talked about earlier related to the common behavioral skill deficits for children with EBD. He mentioned that communication skill deficits have a lot to do with problem behavior. And again, we were trying to teach a break request, but maybe there are some things we can do to improve the likelihood he communicates. But also, even when he did communicate, a denial of a request resulted in severe problem behavior. And regardless of communication, presentation of academic work tended to evoke problem behavior instead of communication. So he really was stuck in this cycle of teacher reinforcing his problem behavior as he punished the teacher's instructional behavior. Really dangerous place to be. And this was even happening with my graduate students who were receiving coaching and were aware of this dangerous cycle or curriculum of non-instruction. So they're still powering through it, but we said, okay, let's think about whether, and let's turn to the literature. Is there an intervention package that is really nicely matched to these deficits? So there is one, and it comes from applied behavior analysis. It's called skill-based treatment. And there is a published study that included children with emotional and behavioral disorders, but kids included in some of the other studies could be classified as having EBD as well if you read about their characteristics. And this begins with a more intensive version of functional behavioral assessment called functional analysis, in which we actually tested, okay, what happens when let's just do an analog of this thing. We think the problem is, we say playtime's done, it's time for you to do some work, and I put on my teacher voice, that's when problem behavior happens. So we really tested that. And in this functional analysis, we actually reinforced problem behavior just to test, is walking that stuff back, what reinforces problem behavior? If so, we know how to teach. We're going to teach in this context of presenting work demands at the same time we take stuff away. So it's highly motivating, highly stressful, because maybe if we teach him to communicate under those conditions, we'll see more generalization in this communication behavior. Maybe he'll be more likely to communicate when he wants a break in less challenging situations. But first, and not but, we start by teaching to those communication skill deficits. So here we worked on teaching him to request under all circumstances. And remember that we kind of combined all the possible antecedents and reinforcers. So here we taught him to say one thing that got him all of that. So instead of just requesting a break, we worked with the teachers to select this response, but he said, excuse me, and waited for an adult to answer, may I please have my way, or may I have my way, please? Kind of a funny way to ask, but it worked for producing all of those things. Escape from work, access to tangibles, access to high quality attention. Remember, he was one of those kids I mentioned at the beginning who had to have it his way. So the language mapped on kind of nicely. But we can't always grant students requests, right? So once he got really good at communicating under that really stressful situation, presenting the work, taking the stuff away, changing into teacher mode, then we taught him to deal with denials. Remember, that was a particular trigger for him. So periodically, now we keep reinforcing his communication sometimes, but sometimes, about half the time, we say no. And at first we just said, when I say no, all you have to do is say okay. You just have to say okay, then I'm going to grant that request. So we got really good at him just like hearing the word no or not right now and saying okay. And we'd say, great job saying okay, we can go back to your way for a while. Once he got really good at that, we get to where we can really do some academic instruction. Okay, so this is, we put academic instruction aside to work on communication skills and that acceptance of denial. Now here's where the rubber hits the road. We're still going to reinforce his communication sometimes. We're going to reinforce that okay sometimes. Sometimes that's going to be like, hey man, good job saying okay. We can go back to playing. But the rest of the time, this should be about 2/3 of the time, and it was for him. After we said not right now and he said okay, we required him to engage with a little bit of instruction. And we were strategic about that. We started with easy demands, and then we increased them in number and difficulty as he was successful. That's called instructional fading. At the same time, we were also thinking about how to respond to problem behavior. And I don't know if you do this in your classrooms or not. Maybe you've had some experience with it. Maybe you're parents and you manually guide your children. Sometimes I do, I have young children. But something that really increases the effectiveness of function-based intervention is extinction for problem behavior, making sure it doesn't pay off, not reinforcing it. So that's something that's often been included with this particular skill-based treatment model, but extinction is associated with an extinction burst, as many of you have probably experienced, and escape extinction, preventing a child from escaping demands, requires physically prompting them to cooperate with demands. And many children, probably all children with behavioral problems, have experienced trauma, and Joshua was no exception. So we weren't going to do that. It was also not sanctioned by district policy for us to go hands-on. So we provided some alternatives, and I'm realizing how behind I am. So I'm going to pick up the pace a little bit, but I hope I don't lose you. What we did was say, okay, you can practice in SBT and your communication skills, your accepting the denial, and your cooperation. You're not going to know which one's going to pay off, but they're going to pay off each periodically in this highly enriched contingent break your way. But at any given time, you can step into this other area that we just taped off in the room, and you can have access to your tangibles. Your stuff is available over there. And the second you cross that line, we're going to stop telling you what to do and trying to get you engaged with reading instruction. So we call that hangout. You can always hang out. It's an ongoing choice. Recall that he never used the unenriched break card. Hangout is now a semi-enriched break. We thought maybe if there's something in it, he'll be more likely to go to hangout. And I think walking away is a really important life skill, and one that children with EBD in particular could use practice with. So hangout almost served as an additional alternative to problem behavior besides communication, saying okay, and cooperating with instructions. He could also leave and go back to class at any given time. This was really important to Joshua because he was always worried that he was missing out. He had the FOMO for sure, and leave was nice. He would sometimes leave our appointments just to check in and see what was going on, and make sure that the deal was better in SBT, or my way game, as he called it. Okay, so those are concurrent options. I like the idea of giving students choice. I think it's good for them, and I do believe it reduced problem behavior, although we didn't directly test that. Now I'm going to show you some data, but I'm not going to get bogged down in it. I'm going to show you this. There's a lot on this graph. This is a little more researchy type data than the data I showed you before, but I'm going to highlight it just to illustrate that we taught the communication skill one part at a time. We didn't go out and say, hey, when you're stressed, I want you to say, excuse me, wait for an adult to respond. May I please have my way? We started with just my way, and we confirmed that reinforced problem behavior. Then we added the please. Then we made it into a sentence, or actually a request. May I have my way, please? Then we added the excuse me. In addition, we required him to use a polite voice, so we added this on after he got the words right. Then to briefly make eye contact at some point during the request, just to make sure the adult's listening to him. And then finally setting his toys aside before making a request and until the request was granted. Before we moved on, we also made sure that the therapist helping him practice did a lot of different things when they were trying to challenge him so that he could practice using his words kind of no matter what the circumstance was. So sometimes they'd say things like, your way's done, it's time to work. Sometimes they'd say, it's time for Horizons. Sometimes they'd say, hey, you need to go to ISS. We were really working on all the things that in the classroom were reported to result in severe problem behavior. Once he got really good at communicating under all of those conditions, we started teaching the denial, and we gave him a good heads up. Here's what we're going to do now. Like up until now, we've always said yes. Now we're going to start saying no sometimes. Here's your job. You will say okay. And that went fine for him for the most part. A little bit of problem behavior while we worked through the early stages. Next, we entered that cooperation training phase, and I've just put a blue box around those data. You can see on this graph that his cooperation increased as our requirements increased. So those horizontal dashed lines you see here show the number of demands he had to comply with on average to get back to his way. And you see that they increased over time. That's that instructional fading process I mentioned. We also had a phase at the end where we had novel teachers implementing, sometimes different people from my group, so graduate students, but some of his teachers as well in a couple of those sessions. That's again, we're programming for generalization. As for his choices, we were happy to see that despite having that hangout alternative, he spent most of his time practicing the skills, communicating, saying okay, and cooperating with academic instruction. By the way, during this cooperation phase I showed you, this is reading instruction. lots of sight word practice, lots of decoding and blending for a decodable word practice as well. So that's where the academic instruction is now coming back in. He did choose Hangout occasionally, and we celebrate that. I didn't want him to not use it. It's intended to be an alternative to problem behaviors. I'd like to see kids opt into Hangout, and he did check in on what was going on in his classroom half of the time. Okay. Finally, before I wrap up this case study here, I have used plenty of time. We wanted to know, we said, okay, well, for one thing, he's been working with graduate students from Vanderbilt. Can he do this with other people who are more part of his life? And we didn't fully answer that question, but can he do this with different people? Also, we told him to ask for his way. Lots of people aren't going to know what that means. What happens when it is denied out in a different context? And can he repair? Can he ask more specifically for what he wants? So the last thing we did with Kendrick before making recommendations to the school staff and offering follow-up support, but pandemic happened some point after that, is we did these generalization probes. So this graph you're looking at has precursor behaviors on the y-axis. That means non-dangerous behaviors that preceded problem behavior. So he would make a grimace or hunch up his body. We were looking for those because we didn't want to wait for problem behavior. When we saw those in this assessment, we went ahead and reinforced them because we wanted to keep things safe. But really what we were looking for were communication skills. Oh, I'm sorry. Okay, good. Sorry, just some extra animation there. So there are different symbols on these graphs. The circles represent attention probes, the squares tangible, and the triangles escape, because we wanted to know, okay, instead of this general thing, can he ask for what he needs in each of those functional categories? So we kind of either take attention away and see what he did. Did we see a precursor to problem behavior, or did he ask for attention? Did he ask someone to come play with him? We would take his stuff away and see what he did. Problem behavior or a request for his stuff back. Same thing with escape. We start presenting demands. Can he ask for a break, or does he show he's frustrated? And you'll see that we saw one precursor and one escape probe and lots of communication across these probes. So we were really excited about that. I'll show you some other information too. He did try the trained communicative response here. Excuse me, may I have my way, please? The adult said, I don't know what that means. And he repaired and said, excuse me, may I have my iPad, please? So we're excited about that. We also like that he used that frame because we think that asking politely increases the likelihood an adult is going to grant a request. He also peppered in excuse me's throughout the probes, which again, we value because we think it's going to help him engage in skills in the real world that are likely to be reinforced and therefore maintained and will stay probable. Okay, also a novel adult implemented this who had nothing to do with our intervention program. And so we're hopeful this means he'll do this out in the real world. So to summarize, we went through several iterations with Joshua. You can see that we were really looking closely. This is a really targeted intervention process in terms of the academic skills we were looking at, phonics and fluency to some extent, but really phonics. And also behaviorally, we really dialed in the behavioral skill teaching. And academic and behavioral supports were integrated at some parts of the process, more integrated at some parts and less integrated at others. But that is just part of the iterative kind of assessment responsive process of supporting a child with comorbid learning and behavioral difficulties. So the recommendations we made to the team to close this out, the school team, were use this skill-based treatment context, the My Way game, to assess his reading skills. So during those practice opportunities, when he asks nicely, we say no, he says okay, we say you got to do some stuff first. That's where we can get some good information. He was highly cooperative in that context. Remind him both before those sessions where you're explicitly practicing those skills, but also the rest of the day, that he can ask nicely. He should accept being told no, that's going to pay off sometimes. Cooperating works, and also walking away is okay. Not only do we want to be transparently reviewing these contingencies with Joshua, we need to continue intermittently and unpredictably reinforcing each of those skills. They all need to pay off sometimes. So it's not like we teach a communicative response and then we leave it behind. It needs to still work sometimes, right? Same with accepting being told no and cooperating. So you might want to surprise a student every now and then. If they think a big math test is coming We'd say this to Joshua's teacher, you've got this, pull out the whole teacher manual and the workbook, make it look like something big is coming, and something big should be coming. You should have instruction planned. But if you're just really impressed with the way he's like, okay, and gets down to business, you can give him what a colleague of mine calls a surprise shorty. Oh, never mind. You know what? You just blew my mind by being so cooperative with that. Don't worry about it. You got to play the long game, right? So make sure that cooperation pays off. This is what we told the school team. Finally, make sure to reinforce the walking away. This is a life skill. I walk away from things sometimes when I'm frustrated as a functioning adult. So let's make sure to provide an opportunity for that. Maybe Hangout isn't always as awesome as it was in the way we were training him. Maybe we do dial back what's available, but maybe we don't. It should be good enough that he uses it, and always reinforce it, because that's ostensibly replacing severe problem behavior. Finally, the team really needed to use this information or this context to continue increasing the rigor of academic instruction. Joshua was so behind. And of course, to progress monitor. Okay, so just remember that's an example of one particular profile of student, and we have to think about academic and behavioral difficulties in assessment, as well as so that we can inform a good integrated intervention. Okay, I'm going to hand it over to Caitlin. Caitlin, I'm sorry, I really did go over.
No, that's okay. Thank you so much. You did a really nice job of giving a thoughtful example of what intentional integration looks like. And the reason we chose to go so in depth with one case study is that, as Brandy mentioned in the beginning, historically, at the teacher level or the school level or the district or systems level, often academic and behavior supports have existed in silos. And whether that's driven by expertise of teachers or a systems approach, or one maybe having more support than another, we've often seen this approach. But then, as Joe shared, there are students who have complexities of need that span across academics and behavior. And so we really need to strategically think about ways we can integrate those interventions. And as Brandy also mentioned, this integration should be happening along a continuum. So while we gave an example of those students with the most intensive needs, we hope that the process that Joey shared about this iterative nature of collecting assessment data, implementing interventions that are addressing components of a student's need profile from a behavioral and academic standpoint, monitoring progress, figuring out if the interventions are working, and then perhaps collecting more assessment data, this iterative process could be applied across grade levels, across settings, and even across tiers. So while we showed you an example today that was the most intensive intervention, a student who had pretty complex learning and behavior needs, that you could translate this to your own students with those needs, or perhaps take pieces of the process that Joey shared and apply them into different contexts within or across the tiers, depending on student needs. So we hope that this was informative to your own practice. We had some great chat happening, and let me just check in to see if there are other questions.
There was one really specific one for Joey to follow up, and that was just about if you saw an increase in Joshua's reading performance as you were seeing improvements in behavioral skills.
I regret to say that I don't have those data, and I actually tried to go back and get them, and I just couldn't access it. And so I'm sorry I can't answer that question. I do know though, so that process, we wrapped up with him shortly before the pandemic. And at the point we wrapped up, he was reading. So I don't have his progress monitoring data, but he was reading words at that point and sentences more fluently than he had been at the outset. So I do think he was more cooperative, and that actually did result in an improvement in accuracy.
That's fantastic. And I'll throw one other question out to the group that came up a couple times in chat. And as Caitlin mentioned, we made the choice to go deep, but that means that we have a lot of kind of information about Joshua. And folks were curious how this would look or sound different if it was an older student. I think the last chat question was about an 8th grader. Someone else asked earlier about middle or high school. So in chat, folks shared a few examples where the process looks similar, and even the break card strategy might be one they've used with older students. But if any of us wanted to comment a little bit more on some specifics about what may look different in high school or middle school, that would be great.
I can start off just because probably the most close-in extension on what you saw. yeah, break cards good, with a high school student or a middle school student, obviously you have to think about how stigmatizing just the topography of the response is, or if it's age appropriate. But I also think that hangout becomes even more important the older the student is. So if you can give students a dignified out, that might be a really important replacement behavior. So instead of a break card, is there somewhere they can go? Is there a designated area? I don't know how much privacy they can have. They can't just walk out of your classroom and be unsupervised. But what would hangout look like if it were age appropriate? Also, in teaching those direct communication skills, so if hangout's just, you can just walk over there, that's one thing, but what words you say. We have students right now, I'm working with some middle schoolers, so they're not high schoolers, but I think that this could potentially work. They're asking for more time. So when something ends that they like and academic instruction is coming, they say, hey, excuse me, or they raise their hand. Can I get some more time, please? And teachers intermittently grant that request or say no and say, you really got to come over and do this work for real this time. Or the other one that we're seeing with one of our current students is, can I do my thing? And honestly, the older students are, the more they can engage with selecting those aspects of their intervention plans. And we've had a really good time having conversations with these middle school students about what they feel comfortable saying. Like one of the students said, I feel like the excuse me is rude. Like, cool. What would you rather do? She's like, well, I could raise my hand. I'm like, okay, well, what if the teacher's turned around and they can't see you? What do you want to try next? And, it's kind of a good problem solving process. So there are a couple initial thoughts. I know this group will also have things to add.
I just think as kids get older, I think that it really highlights the importance of leveling instruction, right? And I think as you get older, you assume that they have more years of failure. And I think in our work with middle and high schoolers, I think what we see is that sometimes the academic demands, just because the students are missing the basic skills, are just too much, right? And I know that's a hard pill to swallow for a lot of people because of the standards that we expect for students to make certain progress in schools. But I think that really taking a close look at sort of what the instruction requirements are and where the students actually are, I think that, to me, that's really the most important piece when you think about, or a important piece when you think about sort of this sort of intensive intervention process with students who are older.
So that was fantastic, because I think in both of those responses, you all kind of highlighted the critical features that we shared at the beginning and Caitlin wrapped up with, but shared kind of how they look and sound a little bit different and more nuanced as you move up in terms of thinking about academic instruction and that relationship. I think the other big picture that we walked away with, both from the case study and these responses, was what it truly looks like to integrate not just the practices, but the data systems and thinking more at the systems level. And, I think in every example, there's nuances that are unique. And so not every example is going to fit every one of our experiences or settings. But I think those core features about outcomes, data systems, practices allows us to be really thoughtful and intentional in the integration. I'm just popping back over to chat. And I think one of the other questions was around the generalization and the extent to which we saw Joshua maybe specifically, or students in general, generalize their skills from an intensive intervention setting back into a classroom. So I don't know if anyone wants to pick that up, because I think it could be more general than just Joshua even.
Well, I can just start by saying, and Joey and I just talked a little bit about this in another presentation this weekend, the importance of planning for generalization. So if you are providing an intensive intervention in a smaller setting or a separate setting, is not just getting to the end of it where you're seeing success and then hoping it translates into the classroom setting, but strategically planning for the generalization of the setting. Joey mentioned, can Joshua do this with someone else? So the person who's implementing the intervention, but then also the skills that you're learning. So can you take those skills that you're learning in one context, in the intensive intervention context, and apply them to the core curriculum that you're learning in the classroom? And it does take active planning for that and the assessment of those skills to make sure that you are planning and setting the student up for success.
I agree. And I also think that it's important to think of generalization on a continuum. So you saw me probing real specifically for generalization because I needed to structure the context to include specific opportunities so I could know, does he use the skill or not under these conditions? And it's a lot easier to see something if you really design a way to see it versus hope for change on really distal, like everyday behavior, where the context varies wildly. Maybe I go to observe and hope for generalization during reading class one day, but the teacher is implementing new material. That's going to reduce the likelihood we see a generalization of those skills because it's going to be more challenging. Or maybe there's something going on with a peer. And so there's so much noise that it takes a whole lot of behavior change before we see stuff changing on a large scale. So I encourage everybody to think about kind of intermediary ways of assessing whether generalization is occurring so that they can learn about what their intervention is doing without having to rely on a really hard to achieve type of change.
Thank you all, and we are at exactly 3 o'clock. So thanks for folks hanging with us. We just popped a couple of the websites for the centers that are not PBIS, so Intensive Intervention and MTSS. We hope you check those out and enjoy the rest of the forum. Thanks, everybody.